Hey, good morning. Dr. James Boone, Medical Director here at La Hacienda, internal medicine physician and addiction medicine doc. Here I want to talk about vaping. It's been hot in the news lately and a lot of conversation, a lot of fears and concerns. So what's the medical data and what are our thoughts? Number one, the vape solution is not just nicotine and water. So when people use those, there are multiple other compounds, including documented toxins like formaldehyde and acetaldehyde and acrolein and diacetyl, fancy words. Those chemicals are certainly not safe. The other thing that's concerning to me is that those chemicals have all been studied safe for human consumption at very low levels. Consumption is very different than inhalation. So fats, for example, safe for me to eat, but completely dangerous for me to inhale, can cause a severe type of pneumonia. So vaping, what is that and what is that process? It was designed as an alternative to cigarettes. Now, if somebody's a cigarette smoker, we've identified over 200 different carcinogens in smoking. Deadly, horrific habit that's terrible. Is vaping safer than smoking? I think that data is pretty clear, and the medical community would say that that answer is yes. Now, is vaping safe? That answer is a very solid no. What we've seen in the news lately, this different type of lung disease that's now led, as of January of 2020, almost 3,000 different cases in the United States with 56 documented deaths. Most people think that was just from THC-containing vape cartridges, but in reality, 15% of that came from nicotine-only cartridges. So is vaping safe? And that answer is absolutely no. Now, from a vaping standpoint, the other big concern on that is the amount of nicotine. So the pods, for example, like the Juul device, uses nicotine salts, which gives very high levels of nicotine. And we know that nicotine can have quite dramatic adverse effects in the developing adolescent brain, specifically the prefrontal cortex, which is where impulse control and judgment takes place, focus and attention. Great deal of concern about that. Vaping really is epidemic proportion in our adolescent and high school kids. Smoking typically at its very peak was somewhere around 8% of high school seniors. Vaping as of 2018 was almost 30% of high school seniors. It's also a concerning new introduction to the cannabis market for adolescents, in that the majority of adolescents now, their first usage of cannabis comes via vape. So at La Hacienda, we certainly don't allow them on campus. We've had amphetamines, fentanyl, dangerous compounds tried to be used in a vape. So not something that we think is safe. Really just some information for you to consider the next time you have a patient or a client or a friend talk to you about vaping. If you have further questions, we're here to help you, and we appreciate your time.